So now we'll move into reflex. So tone is done, power is done. So next reflex, so we'll start with Hoffman. So Hoffman, what do? In any form of reflex, you have to make sure that the patient is comfortable, is fully relaxed. So Hoffman, what we basically do is we flick the interphalangeal joint of the middle finger and see if there's any flexion of the index finger and the thumb. So make sure, try to see if the patient can fully rest their forearm, okay, for example, and ask them to hang the hand loose. Okay, so make sure you have completely relaxed, and then what you can do is you just immobilize the interphalangeal joint and you just flick it. Okay, you just flick it. Okay, you just flick it. So in a positive Hoffman, the moment I flick the DIP joint of the middle finger, you will notice the flexion of the index and thumb, like coming together. Okay, so this is negative, so this is a significant finding in cervical myelopathy, which you have to take note. Next, we want to see supinator reflex. So normal supinator reflex will be present in us, in physiologically healthy beings. And in a case of cervical myelopathy, you will get something we refer to as the inverted supinator reflex. So let us see how we get a normal supinator reflex. So it is important on how you want to position the patient. So the patient's right forearm, let's say you're going to test the reflex on the right forearm. The patient's right forearm must rest on your right forearm. Yes. So completely relax, and you can hit on the brachioradialis. Okay, so this is how you position the patient. So the patient's right forearm must rest on your right forearm. Make sure the patient is completely relaxed, and make sure when you hold the tendon hammer, we had seen this before, the mechanism, so you have to hold it at the tip. The ideal of giving a swing is to create momentum, because there's a mass here. So there's a movement, there's speed, and when you give it direction, it becomes velocity. So mass and velocity will give you momentum, and that is what we are interested here. So normal supinator reflex. In the case of cervical myelopathy, what you can get is you can get an inverted supinator reflex, where you won't get the contraction of the brachioradialis. You won't get a flexion of the elbow. What you will get instead is the flexion of the fingers. So this is what you'll get. You won't get a jerky movement like this, like what we saw just now. Instead, you'll just get flexion of the fingers. That is what we refer to as an inverted supinator reflex, and the root value which is involved here is C6. So if you find an inverted supinator reflex, remember that the level of lesion is involving or above C6. Okay. So simple, rather simple. So just use your finger to mobilize the tendon, and you just give a swing. Okay, next we are going to look at the scapulohumeral reflex, which is mediated by C4. So this is absent in normal individuals. Okay, so if this is present, then it means that it indicates the cervical myelopathy. It's a specific finding for cervical myelopathy. What you will get is the moment you tap, you will get abduction of the shoulder. So where do we hit? So you hit at the tip of the spine of the scapula. Okay, so you palpate. You find the tip of the spine of the clavicle, of the scapula, and you hit. So expect it, and do the same on the contralateral scapula. Okay, relax. Okay. Jerk. We just ask the patient to completely relax, so his mouth should be slowly gaping, slightly gaping. Okay, and then you just put your finger at the chin and you just. Okay. So if the reflex is positive, they will close. There will be a closure of the mouth. Okay, so this will be pathological, and it indicates it's mediated by C1. Okay, so it gives a picture of a lesion involving C1. So among the reflexes, some are just general. They are positive for just an upper motor neuron lesion. For example, the biceps reflex also. But there are some reflexes which are important to note, as they are quite specific. The findings are quite specific to cervical myelopathy. The first is inverted supinator reflex. So in normal physiology, you would not have an inverted supinator reflex. You will have a normal supinator reflex. Okay, that's for C6. Then in normal physiology, you will not have the scapulohumeral reflex. So the presence of scapulohumeral reflex mediated by C4 indicates cervical myelopathy as well. And the presence of jaw jerk, so which is normally absent, is also pathological. So this is mediated by C1. So why is it important? So let us say you have a positive inverted supinator reflex, but you have a negative scapulohumeral reflex, a negative jaw jerk. What does it mean? That it means that the level of lesion is between C4 to C6. It is not beyond C4. Okay, so just around here. It could be C5, okay, C6. Okay, let us say inverted supinator reflex is present, scapulohumeral reflex is present, and jaw jerk is absent. So the level of lesion will be below C1. Okay, it will be between maybe it could be C2, C3, C4, C5, C6, etc. So it will be below C1, but it can involve, so it could be maybe from C1 to C6. Okay, and let us say this is present, jaw jerk is also present. That means it is involving C1 and above. Okay, so that will help you estimate the level of lesion. And of course, Hoffman reflex is also specific to cervical myelopathy. So if it's positive, it is for cervical myelopathy.